Okay, greetings and welcome to How to Review Biomedical Literature. It's a very, very important aspect of a clinician's life to read scientific journals and to be able to evaluate critically or appraise the literature so that you can get the maximum information out of them. Now, not everything that is published should be taken for what it's worth. So we always need to be careful when looking at the literature because we need to be able to understand what the study design is. We need to be able to understand how the data was analyzed, whether the authors have done a good job or not. Even though articles are peer-reviewed, and pretty much most medical journals have peer-reviewed articles published in them, however, it is always good to be on the cautious side. This is just primarily good scientific practice, both for yourself as a clinician as well as for your patients for whom you might be making decisions based on the literature articles that you have read. So a few quick terms. Biomedical studies or biomedical research is basically an applied field of research where we're using statistical, epidemiological, and other methods or translational research to medical concepts or biological concepts. Literature review really refers to the ability to critically appraise a literature. When I say critically appraise, I don't mean pick it apart. What I mean is to be able to discern whether the research study has been done appropriately or not, whether the methodology was strong enough, whether it was good enough, whether the data was appropriately analyzed, and whether the inferences were appropriately made. So this seems like a daunting chore, and there's ways to do it. Every single article starts with a title. So let's start with that. The title should be relevant to the article, so it should really tell you what the article is about, and it should include some of the keywords in the article. For example, if you're going to do a study or if you're going to read an article about diabetes mellitus, then the article should mention that, or the title should mention diabetes mellitus upfront. The title should not be excessively long and it should not be distracting from what the content is. So it should be really related to the content and include the keywords. Based on the title itself, we cannot actually accept or discard the article. So we have to look at the elements of the title and see if they fit the criteria. So first, does the title have the keywords? Some of the keywords mentioned. Do we know what this study is going to be about? Is it related to the field of work that it's placed in? So for example, I would see articles with diabetes mellitus placed in very different areas, for example, lung disease, which is a far out example. But I would see that and then it wouldn't make sense because it does not need to be cataloged in there. So first, just quickly scan the title to see if this actually is related to the area of work that it's supposed to be related to. The next thing comes the abstract. Every medical and scientific journal has a very standardized abstract. So in the abstract, you have your introduction, you have methods, you have results, you have conclusion. Some abstracts might be restricted to 250 or 300 words. Some abstracts may be a little bit longer. It really depends upon the journal. But they do have each of these 4 sections. And if the abstract doesn't have or is not organized by the section, that is sort of indicative that the paper quality may not be that great to begin with.